if the female body and intelligent design of the month is designed based on cycles of estrogen in particular, and estrogen gets removed either because of menopause or PCOS or changing issues or surgery or whatever, that something to your body's natural process every month
of
is
shutting
wrong,
down that inflammation.
and now your whole body's like, something's wrong.
Right.
We need some estrogen down there, and the body doesn't respond.
The ovaries can't do it again. They're done.
It's like your whole body's like, whoa, broken bones, something's wrong. What are we doing? And it races everywhere.
So in the joints, we see arthralgias, just this.
What is that?
Arthralgia is pain in the joint.
That sounds like an ugly version of arthritis, arthralgias. It sounds like something that you would get in one of these fantasy novels. You know, the arthralgist comes over the hill.
So in the heart, let's talk about the heart.
Okay.
When we get to this like hyper-inflammatory state, we see palpitations, that sinoatrial node. So there's a little node, there's a little part of the heart where it sends out a signal to control our heartbeat. It's called the SA node, sinoatrial node. That thing is super responsive to estrogen and likes estrogen and likes it, keeps it calm and like beating in a night thing. You take estrogen away, all of a sudden some women will start having palpitations out of nowhere.
Wow.
And they go to the cardiologist, they get their $1 million workup and they're like, don't know what's going on. And we're not training the cardiologist to say this might be part of her menopausal picture.
And you want to know something else that I'm just like, actually, as my brain is churning and all this is starting to go click, 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 is that if there's not comprehensive training and if there's not advocacy for what these symptoms are, then there's also no health insurance code to cover the cost of a lot of the diagnostic stuff that actually points to what is causing this.
Medicare does not pay for a menopause visit.
That's insane.
Right.
What?
Yeah. Your well woman exam, that is devolved into screening for breast and cervical cancer. That's it. You know, that 15 minutes with your legs in stirrups is not the time to like do a comprehensive menopause visit. So you need to schedule another visit, you know, go in with your armed with questions, go in with your family history and all the symptoms.
And it sounds like don't call it a menopause visit. Say I'm having lots of symptoms, but don't call it so it gets covered.
Exactly.
Wow. Wow. Okay. So the heart, the lungs, how does estrogen impact
asthma, inflammatory disease? We
What?
see an increase in asthma, and actually asthma that doesn't respond as well to the typical bronchodilators.
Well, that makes sense because it's like an internal system functioning thing where the oil and the gas is no longer in the engine.
Yeah.
Wow. What about like your digestive tract?
So the gut, you know, the gut health changes dramatically. And when the gut health changes and the gut microbiome changes, how we kind of reprocess our estrogen changes a bit as well, the kind of the metabolism part of it. And so, you know, lots of research going on in that area right now. Our bones, we've known forever osteoporosis. Now, what your listeners may not realize is that osteoporosis is completely preventable for most women. And they don't know how. We're not diagnosing osteoporosis usually until you have a fracture. And 50% of women before they die will have an osteoporotic fracture.
So just for somebody who's listening that doesn't know what that word means, could you,
Sure.
is that like fragile bones, bones density?
Bones.
What does that mean?
So our bones density maxes out like how thick and strong our bones are. The thicker, the stronger, the more resilient to fracture they are. Okay, in general. And we're constantly remodeling our bones, which is why I'll explain that in a minute, which is why when we break them, they fix themselves if you line them up.
Interesting.
So we are constantly chewing up bone like Pac-Man and then pooping out new bone behind it, you know.
Really?
Yes. And so we're always, the bones you were born with were not the bones you had at 10 or not the bones you have at 20. We have totally chewed up and laid down all new bone. What happens in menopause or in women with chronic suppression of ovulation, chronic low, you know, postpartum, multiple babies, we start chewing up more bone faster than we can lay it down. And that accelerates in menopause. So we end up with this porous bone with holes in it, basically, that is a lot easier to fracture. Now, if you fracture your hip, so if you're 65 plus, and that is 10 years away from us, and we fall, climbing up a ladder, chasing a grandbaby, hopefully maybe one day, no pressure to my children. And we trip, we take out a hip. Even with surgical repair, we have a 29% chance of death in that first year. And if we survive...
I need everybody to hear that. This is really serious. She's basically saying bone density starts to decrease based on the decrease in estrogen. And aging. And that makes you more fragile and prone to having a broken bone. And she is also saying this is preventable.
For most women.
For most women. But if you fall and break a hip at the age of 65, 29% of you will die.
In the first year.
In the first year.
With surgery. Without surgery, it's like 79%. So they're all getting surgery. Yeah.
Wow.
And so say you survive, the rest of your life is marked with chronic disability. Not being able to take care of yourself, which is, my patients don't come in saying, I want to rock a bikini. They're looking at their mothers, they're looking at their aunts, and they're like, get me off of this path. I don't want this.
Yes.
Or they're looking at a really healthy mom who's running around and is not frail, not decrepit, taking care of herself, and they're like, make sure I stay on this path. And that's where the work begins.
Wow. All right, we've covered bones. What else?
Genitourinary syndrome of menopause.
Okay, what is that?
So that is a big mouthful. It used to be called senile vagina. That was a medical term.
Senile vagina?
Senile vagina.
Was a medical term?
Yeah.
It sounds like
bone to the end of your tailbone, just all of that area is highly sensitive and highly estrogenized. And when that estrogen level drops, we lose elasticity, we lose stretchability of the vagina, which might be helpful on occasion.
Is that why sex is painful? Sometimes?
For most women, they have atrophic area. So they've lost their elasticity. They can't make mucus anymore. The tissue is thin. If you look at a biopsy of premenopausal vagina, it's this thick, velvety, elastic, beautiful, bring it, baby.
Yes.
And then this postmenopausal woman who's never been treated, it looks like the Sahara Desert. You've lost layers and layers and layers of tissue. It's very dry. It's very small. And she's just gritting her teeth through sex.
And that is because
it's horribly uncomfortable. I'm a hiker. And so I've got to use, even with, systemic estrogen, if I don't make sure that area is well moisturized,
right,
things might, and also the architecture changes a little bit. So things are hanging at different levels. And so I love to hike. And so I'm going to have some chafing and things that I never had before. Right. I need to make sure I'm getting lubrication in that area.
Right.
So I can hike comfortably besides everything else I want to do in that area.
And this is
preventable.
Preventable.
Yeah. Now let's talk about how it can kill you. Recurrent UTIs, the bladder health, the urethra health, besides incontinence. The number one treatment for recurrent UTIs in a postmenopausal woman, the most effective treatment is vaginal estrogen, not chronic antibiotics. I'm going to save someone's life by this podcast because I'm going to keep someone from dying from urosepsis because she got vaginal estrogen after listening to this podcast.
This is amazing.
Yeah.